In 1994, between 800,000 and 1 million lives were lost in the Rwandan genocide. Many of those killed were doctors, nurses, and highly trained members of the medical community. A decade and a half later, this tragic loss is contributing to a healthcare crisis in Rwanda. In the western province of Rwanda, many people walk 2 days to reach the nearest hospital. With a handful of doctors, only 26 ill-equipped clinics, and 3 small, shockingly impoverished hospitals serving over 650,000 residents, the need for quality health care is desperate. Over 210,000 Rwandans are living with HIV/AIDS. Many also suffer and die from malaria, tuberculosis, chronic illness, and malnutrition. The healthcare issues facing Rwanda are overwhelming, but there is hope. Today, a visionary component of the peace plan is underway in the western province of Rwanda. Through the Western Rwanda HIV/AIDS Healthcare Initiative, a new church-initiated sustainable model has begun, and lives are being saved. The local church is partnering with the Rwanda Ministry of Health and other agencies to provide increased access to quality health care. In the rural areas of Rwanda, hundreds of churches are being mobilized to act as satellite healthcare centers. Thousands of church members are being trained to work alongside medical professionals to provide primary and preventative healthcare assistance.
The church has done a lot in mobilizing the community. Before, we used to think it was only the hospital and the doctors who were responsible for the health care. Now it's not only the role of the doctors, but the community, business, and government. We are all working together, so it has helped us with the synergy of cooperation, and everyone is taking responsibility for their own lives.
In a graduation ceremony outside of Kabuye, these 225 new Community Development Volunteers, or CDVs, will join the ranks of hundreds of others in providing physical and spiritual health to their communities. Having received extensive training, these Community Development Volunteers will be responsible for a caseload of 7 homes in the area in which they live. As they personally visit each home, they teach their neighbors lessons from the purpose-driven life and conduct primary and preventative healthcare lessons. This grassroots movement of the Peace Plan is growing exponentially and building a sustainable model for healthier communities.
Patients are being followed up in their community. This helps to get good results on medication and prevent, for example, HIV resistance on medication. It's helping us to mobilize people, sensitize people on how to prevent commonly seen diseases, which is good. The first aim of health practitioners is to prevent diseases, and the church is really helping us.
What is happening through the CDT ministry is that the content of the program is focused on self-discovery. People have to have a different worldview, not a handout mentality, but now they're getting into, oh, this is my problem and this is the solution, so they're moving forward towards that. So the content helps in the training and the methodology to change their mindset.
Today, churches are answering God's call to provide love and care for the sick. Through the Peace Plan, ordinary people are being empowered by God to make a difference in their communities. The Western Rwanda HIV/AIDS Healthcare Initiative is exponentially increasing access to quality health care, helping Rwanda achieve its goal of ending AIDS, bringing hope and healing to a nation in need.